Hey guys, it's Louis here from ndxtesting.com, and in today's video we're going to discuss the ultimate guide of how to deal with sleep apnea. So if you have sleep apnea, or you're at the beginning of stages of sleep apnea, or you have suspicions of having this disease, then what we're going to do is we're going to organize all the information that's out there, and we're going to put it in one, because there's a lot of stuff, a lot of information on YouTube and just on Google, and when you go to these doctors, they don't really tell you exactly what you need to do. So what we're going to do is we're going to organize it. Now, I'm not doing this video based on the stuff that I learned. I'm doing this video based on experience, because back in 2017, I went through a really bad situation where I developed high blood pressure. And that's one thing you need to know automatically. If you have sleep apnea, it's going to increase your blood pressure. It can increase your heart rate, and you can develop anxiety. Now, I had all three, and I had no reason why. I went to the doctors, and they had no idea. And guess what? I was telling them pretty much, listen, doc, there's something going on in my sleep that I didn't know about, because I would go to sleep fine, and all of a sudden I would wake up in bad condition. I knew there was something going on in my sleep, and I'm spoon feeding these doctors, and they can't tell me. All they have to do is like, wow, something's going on with your sleep, just go to a sleep medicine doctor. But anyway, I have a whole video on my personal story. This is not about me. This is about you, to give you the ultimate guide of how to deal with this. And I think that this video is really going to accomplish that. Now, the first thing that we're going to discuss is the difference between snoring and sleep apnea, because there's a clear difference. Okay? So when you snore, what do you think that means? It means that you are struggling to breathe. And guess what? You can't struggle to breathe when you're sleeping, because it's going to affect your health, and you need to really understand that. Now, it could be that maybe you're sleeping the wrong way. It could be maybe you have some breathing obstructions. It could mean a few things, but whatever it is, you need to take care of it. If you are snoring, maybe you have your mouth open, whatever the situation is, you need to take care of it. You cannot snore, because that means you're struggling to breathe. And if you're struggling to breathe, you're not getting the right type of oxygen that your cardiovascular system needs, your veins and arteries, your heart, your peripheral nervous system with your nerves and muscles, your brain. It can affect your health in the long run. Okay? So if you could breathe good during the day and you're struggling to breathe at night, these things have a solution. The snoring situation constantly, especially if your wife or your husband tells you that you are snoring, then it can lead to sleep apnea. So you got to be able to fix that at its root. Now, sleep apnea means that you are also snoring extremely loud, but the difference is that you stop to breathe and you wake up suddenly out of breath. And it also carries symptoms of high blood pressure, anxiety, and a rapid heart rate. But the truth of the matter is that sometimes you go with these conditions, especially if you don't know that this is coming from your sleep. You go with these conditions, right, to the doctor, like I did. And your internal medicine doctor, educated maybe from 20, 30 years ago, 40 years ago, it's not going to have a single clue. Now, how do you deal with sleep apnea? Now, the first thing you need to do is that if you dealing with sleep apnea, that means that you're struggling to breathe at a high level than snoring. Okay? Because with snoring, you're struggling to breathe. But with sleep apnea, you're struggling to breathe, but then you stop breathing. Okay? You're probably choke in the middle of the night, or you wake up suddenly, or sometimes you don't even know these things are happening. Now, later on during this video, I'm going to show you what device you can use that you can put in your finger, and it can record your sleep, and it can give you a nice little report, and it can tell you exactly what's going on with your sleep. Because I said from the outset of the video, the most important thing is sleeping and breathing. If you can't sleep accordingly, if you can't breathe accordingly, then you have nothing. So now, obviously, let's get into what you could do. So if you have suspicions of sleep apnea, right? I think that number one, you have to be aware how you are breathing. Most of the time, what people do is that they're sleeping on their back, and they're breathing through their mouth, and they have their mouth open, and they think that breathing through your mouth while you sleep is good, and it's really, really bad for you. Mouth breathing, you need to understand that it's the silent epidemic that is destroying the lives of millions of people, and people are developing cardiovascular disease, high blood pressure, anxiety, a rapid heart rate, diabetes, gingivitis. It destroys also the shape of your face while you are growing up, right? And it expedites the aging process when you are getting older. So you got to be able to breathe through your nose. That is the number one thing that you need to put in your subconscious. You need to breathe through your nose while you are sleeping. And you could be developing symptoms of sleep apnea if you are sleeping and breathing through your mouth. So one of the things that you could do to avoid to breathe through your mouth while you're sleeping, if you're sleeping on your back with your mouth open, then you need to understand that you can't do that. You need to sleep on the side. You can use 2 pillows. Sleep a little elevated, right? That's the way you're supposed to sleep. Sleep on the side, mouth closed. Now, one of the questions, and then you breathe through your nose, of course. Now, one of the questions I say, how do I know if I'm breathing through my nose or I'm breathing through my mouth? Well, we're going to get into that for a second. Like I said, this is going to be the ultimate guide of how to deal with sleep apnea. So we're going to give you a lot of components of how to deal with it, a lot of tools of how to deal with this. Okay, but you need to be able to pay attention and to know that you need to breathe accordingly. Breathing accordingly it means breathing through your nose, not through your mouth. You cannot breathe through your mouth whatsoever. That is going to get you sick. Now, once you understand that you need to sleep on your side and you need to breathe through your nose, not through your mouth, that might improve the situation automatically. But if you have suspicions of sleep apnea, you make an appointment with your ENT doctor. And once you go to your ENT doctor, you let them know, listen, this is going on. I think I'm snoring. I think that I stop to breathe because I wake up suddenly out of breath. If those are your symptoms, but you can also have high blood pressure, anxiety. You can have a lot of different symptoms, but you don't know why, and it's coming from your sleep. So then what they're going to do is they're going to check. You want to know if you have any breathing obstructions. You want to know if you have any breathing obstructions on your nose. Then you want to know if you have any breathing obstructions on your throat. If you are clear, then you can do different things that will be able to help you. Like I said, you sleep on the side, elevated, right? And you breathe through your nose. Now, once this information is in your subconscious, if you can breathe accordingly during the day, or maybe you're mouth breathing during the day and you don't know that, then you stop that automatically. You start breathing through your nose. Okay, you breathe through your nose with your mouth closed. If you train yourself how to do that, it will carry over at night eventually. Most of the times, sometimes I wake up in the middle of the night and my mouth is closed. It's not open. But we're going to help you. We're going to help you to learn how to train yourself to keep your mouth closed at night in a minute. So now, going back to the doctor, after you are clear, obviously the most important thing that you could do is perhaps get a sleep study. Now, you don't have to be scared of a sleep study. You can tell the physician, right, that you want a home sleep study. You don't have to go into these hospitals. You get a home sleep study, and then they'll tell you exactly what's going on. Now, I'm going to tell you something really quick. Most people in this field of sleep medicine think that people develop sleep apnea because they're overweight, and that is far from the truth. Let me tell you something. I'm not overweight. I'm 176 pounds, 5'9", and I was 176 pounds, 5'9" back in 2017 when I developed sleep apnea, and I was never overweight, but I developed sleep apnea. Why? Because the number one reason that people have sleep apnea is an overbite, and that's what I have. So when you have an overbite, ladies and gentlemen, the position of your bottom jaw, it's all the way in the back, and it's going to compromise your airways, and you won't be able to breathe accordingly at night, especially when you have your mouth open. And one of the reasons that people develop an overbite while they're young is because they started mouth breathing when they were young, or maybe failure to get braces when they were in their teens in order to be able to correct the bite. So you got to be able to look at your bite and see if that is the problem. And I'm telling you, 98% of people that have an overbite can develop sleep apnea if they're breathing through their mouth. And a lot of people don't know their mouth breathing. It's really bad for their health, and it can destroy your health and destroy your brain and destroy the shape of your face. So you cannot be a mouth breather. So these are things that you need to be able to understand. So the second thing that I would do is you go to an orthodontist or go to your dentist first. Listen, doc, I think that I have sleep apnea. Can you look at my teeth? Because it can show up in your teeth. It shows up in your gums. And if you have an overbite, then you can go to the orthodontist and you can correct your bite from these things, so these things do not happen. Okay, so now you have the ENT doctor that can check if you have any breathing obstructions in the nose or in your throat. If you do, then they'll take care of it. Then you have a sleep study, okay, and then the sleep study will be able to tell you exactly what's going on. You need to go to a dentist for sure. It doesn't matter whether you think you have an overbite or not. You need to check. Okay, when I'm telling you this is the ultimate guide, this is the ultimate guide. You go to the dentist, and after you go to the dentist, then the dentist will be able to tell you, okay, you know what, you do have an overbite. Go to the orthodontist so he can correct your bite. You're going to end up at the orthodontist anyway. I'm going to tell you why towards the end of the video. So now you have the orthodontist, okay? And now the orthodontist can tell you exactly what is happening if you have an overbite or not. Now, moving forward, what are things that you can do if you have an overbite, or if you are breathing through your mouth, or if you want to just protect yourself from sleep apnea? Now, one of the first things that you can do, right, in order to be able to breathe a little better, right, you can get some nose clips, right? You get some nose clips, you put them on your nose, right? One of these, you put them on your nose, right? And that would promote you to breathe a little better through your nose, and also it can help you to keep your mouth closed. So this is something that you can do that it can improve so you can breathe better. So another thing that you can do, remember I was telling you, okay, how do you keep your mouth closed at night? Now, once you have this information in your subconscious, once you have this information in your brain that you're not supposed to be able to breathe through your mouth at night, how do you prevent yourself? Well, in the daytime, you practice. You practice in the daytime by breathing through your nose. You keep your mouth closed, because a lot of people are mouth breathers. They're breathing through their mouth all day, and they're not aware. Once you're aware, once the subconscious it's aware, then it begins to understand. But you're going to need help. Now, I don't know if you ever heard of the company called Somnifix. Somnifix.com. They specialize in mouth tape. Now, this is a little strip of tape that you put on, right? You open it, right? And I'm not going to open it to the fullest, right? But you'll be able to understand. It's a little strip, right? It's very popular. I'm going to leave the link in the description, so you can go to the company, right? You go to somnifix.com and start educating yourself about what mouth tape does. Now, it has an opening, so you'll be able to breathe through your mouth. It's not like you're going to choke or something's going to happen. All right, but this tape starts training you to keep your mouth closed, because it's going to prevent you from you opening your mouth, and it's going to prevent you from breathing through your mouth all night long. It starts training you. But obviously, before you do this, you need to check with your ENT doctor, because if you have breathing obstructions, then you cannot breathe. This is only good if you can breathe through your nose. Now, I don't have a problem breathing through my nose. I breathe through my nose fine, but there are some people who cannot breathe through their nose. That's why I said you need to go to the ENT doctor. That's the second thing you do. First thing to do is recognize that you cannot sleep on your back. You cannot sleep, and you cannot with a flat pillow, or maybe breathing through your mouth. Whatever, you need to sleep on your side. You need to be able to breathe accordingly through your nose. Okay? So now, that's number Number 3, number 4. Another thing that you could do, right? The people do sometimes, they get themselves a chin strap that they can put on. This chin strap helps you keep your mouth closed at night, and it kind of pushes your chin forward a little bit. I'll be honest with you, I don't use the chin strap much. It didn't really work for me, but on my YouTube channel, there's been a lot of individuals that it has helped. Now, this one in particular didn't help. This is supposed to be the Sleep Pro, but it didn't really help me much, so I don't use it. I don't need it. And but there's one that one of my subscribers was talking about that he bought in Walmart, and it seems a little better than this one. So I'm going to buy it just to check it out, because it might work. But then again, listen, chin straps are good, and you have to know that when you have this condition, you got to try everything in order for it to work. Now, another thing you can do, right, is that you can go to a sleep medicine dentist. Now remember, the objective is to be able to open up your airways when you have sleep apnea. Because if you have sleep apnea, you got to understand this. Maybe I didn't mention it in the top of my video, but it means that your airways are being compromised somehow, and they're closing. And if they're closing, I'm telling you, there's only one reason why your airways can close, and that's because if you have an overbite, or if you're overweight, that's what they teach. But when you're overweight, it means that you have excessive weight. I know people that are 300 pounds that don't have sleep apnea. They even snore, but they don't have sleep apnea. So weight is not the main issue, but that's what they teach you. But I was never overweight. My situation was an overbite, so that's why you have to check that. So if you're struggling to breathe at night, that means that something's blocking the airways. Now, that's what I said. You go to the ENT doctor, you can have a breathing obstruction there. Maybe you have a good bite, but maybe you have some excessive tissue for whatever reason, but you need to take care of it. Or maybe you have something on your nose. It says that 80% of the population have a deviated septum, but some of them have a really bad one, so maybe it's coming from your nose. Whatever it is, it's connected. An ENT doctor is an ear and nose and throat doctor, so you have to be able to go and check if you have any obstructions there. But anyway, what the sleep medicine doctor would do, right? In order to push your airways forward, he will make you a dental appliance. Okay? You see that? Looks like it looks a little blurry. It looks like a mouthpiece here, you know? And the material, it's kind of hard. Now, I got this, but a lot of people complain about this dental appliance. And the reason they complain about this dental appliances is because they're really uncomfortable. And I couldn't wear this. Maybe it's good to wear in the daytime to kind of, because it pushes your bottom jaw forward. You wear it in the daytime, and you can use it for some sort of therapy. But what I noticed two things about this dental appliance pieces. Right? That number one, they're uncomfortable, and there's a lot of people complain about it, they're uncomfortable. And number two, it's really hard to keep your mouth closed with this thing. Yeah, it pushes your bottom jaw forward, but I couldn't even close my mouth. This thing was so bulky and so uncomfortable. So if you need to breathe through your nose at night and not through your mouth, this thing is not going to help you breathe accordingly. You can't close your mouth. At least that was my experience with this. And a lot of people complain about these dental appliances. So there has to be more solution. Now, remember I was telling you about that you can go to an orthodontist. Now, an orthodontist, right, could make you a retainer. Now, some of these retainers are very, and they can make you a bottom retainer. They can make your top retainer too, but that's up to you. You see how small this is? I don't know if you see it, right? Because really small, right? You put this on your bottom, right? I'm not gonna put it on because I have to clean it first. Really comfortable. And what that's going to do, right, if the orthodontist makes it tight, it pushes your bottom jaw forward. Now, what that's going to do also, it's going to prevent from your bottom jaw to fall back and close your airways. And at the same time, Another thing that you need to understand is tongue posture. Okay, so if this is the roof of your mouth, your tongue is supposed to be at the roof of your mouth when you are sleeping. So that's going to place your bottom jaw fixed. But if you open your mouth while you're sleeping and you have your tongue all over the place, that's not going to help. So you got to have proper tongue posture, and you have to be able to have your mouth closed. But the retainer is pretty good, because the retainer will be able to push your jaw forward, and it's going to keep your airways. So I think that going to an orthodontist and getting some sort of retainer would be a lot better than getting one of these dental appliances. At least this material right here that I got from this doctor, I really didn't like it. So now, what else can you do? All right, obviously you have the CPAP machines, but the problem with these machines is this, okay? If the truth of the matter is with the CPAP machines is that more than 50% of the people can't handle that sort of treatment. Now, who the heck wants to sleep with these type of machines that's blowing air into you? They're very, very uncomfortable. So now at the 50% of the people that do end up with the treatment, a lot of them also drop out because they can't keep up with the treatment. Now, what happens with the CPAP machines, if you don't know how to clean them, and if you don't know how to really take care of them, just sometimes it leads to infection. But the problem that I noticed with the CPAP machines is the CPAP machine to me is like medication. Okay, you need to understand the root cause of the sleep apnea. So I'm telling you, the 90% of people that have sleep apnea, it's an overbite. So if the overbite is the problem, all you got to do is correct the overbite. Now, the other 10%, it could be overweight, or it could be breathing obstruction that you have in your throat and nose. So now you go to the ENT doctor and you fix that. Okay? Now, if you don't qualify to get orthodontic work where they can fix the overbite, then that's why you have this patchwork. You have things that you can do. Like, for instance, I sleep with a little bit of mouth tape every single night. I don't have any breathing obstruction whatsoever, so I'm supposed to keep my mouth closed. So I put a little mouth tape on it, and I keep my mouth closed, and I breathe accordingly, and I don't snore. So now, I almost forgot to even say this. When I say this is the ultimate guide, I'm going to give you guys 5 more components. The first 2 is this. Listen, if you snore, right, and if you have suspicions of sleep apnea, one of the things that you can do is you can also rinse with salt and water. When you rinse with salt and water, right, it kind of gets rid of whatever inflammation you have here, and then your airways won't close. You'll be able to breathe a little bit better, because that helps a lot with sleep apnea. You can look it up. Okay, you won't snore. Right, so that also helps. But pending that you keep your mouth closed and you consult with your doctor, and you sleep on the side, and you don't sleep flat on a pillow with your mouth open, because then the salt and water is not going to help. But salt and water helps overall. So, and it also helps with your gums and with your teeth. So that's pretty good. Okay. So another thing that you could do, right, if you snore at night, or if you have suspicions of sleep apnea, right, you can use extra virgin olive oil. You can take extra virgin olive oil, right? Now, one of the things that I learned from one doctor that I was following, right, he said that if you have extra virgin olive oil, enough extra virgin olive oil in your body, right, guess what happens to cholesterol? Cholesterol just slides off. It won't stick. Now, when I was younger, right, when I was 5 years old, 6 years old, I mean, I grew up in Colombia. I grew up with my grandparents. I didn't meet my parents until I was 7, 8 years old. Not my real parents, because they were here in the United States. When I used to get sick, right, and I used to develop a cold, when I used to have all this phlegm, I mean, we didn't have any Tylenol back in those days. All these fancy medications that these kids have today. What did my mother give me? She gave me good old-fashioned castor oil, and that will dissolve the phlegm. It will clean me up completely. So when you take 2 teaspoons, right, or a spoon, regular spoon of extra virgin olive oil, what that's going to do to you is going to lubricate your respiratory tract so you won't snore. And even if you have your mouth open a little bit, you won't be able to snore. It's almost like having that squeaky door. You open it and you close it and it squeaks. I've had that problem in my house many times. It could be any door. It could be a cabinet door. I take WD-40, I spray it, and it goes away. So when you consume extra virgin olive oil, especially the ones for salads, right? It lubricates the respiratory tract and it helps you not to snore. But obviously you need to sleep accordingly. Now, when it comes to dental appliances, right? There's a company out there. I'm going to leave the description. I'm going to leave the link on the description. There's a company called Blue Sleep. Now they're making these dental appliances like Invisalign, which I had Invisalign a very long time ago, and Invisalign is really, really uncomfortable. I mean, really comfortable. A lot better than this mouthpiece that people are making. The doctors, the Dental Sleep Medicine Association is wising up, and they're realizing, you know what, they can't make this because this is really uncomfortable. No one's going to go back. I didn't go back to that doctor. If this doctor would have had more advanced technology, right, then I will go back and he would make me a mouthpiece that's a little bit more uncomfortable, but I can't sleep with this thing. I have it for the purpose of making these videos. Actually, my wife wanted to throw it away. It's like, no, don't throw it away because I'm going to make a video. I'm going to show people, you know what? These dental appliances sometimes are not good. People complain about it. I was told that these were uncomfortable, but I'm like, well, I mean, I'm going to do it anyway. And when I had it and I put it in my mouth, there's no way that I can do this. They also have a company called, I think, Z Quiet, right? It's kind of a silicone material, and you can also use that as a mouthpiece, as a retainer, so you can help push your bottom jaw forward and you can keep your airways open. But anyway, guys, I don't think that I missed anything. Oh, I did. Let me come back really quick and let me show you what I mean by that, okay? All right, guys, when I told you before, right, that this is the ultimate guide, I almost forgot all the digital components that I'm supposed to share with you guys. So the first thing, right, if you have suspicions of sleep apnea, you're snoring, you got to be able to have a smartwatch. I just changed watches, okay? Now, I have a watch with this company called Vibe. It's a smartwatch, right? And it records your oxygen levels, it records your heart rate, but it gives you key information about what's going on with your sleep. So if you have issues sleeping, and I said it, remember, the most important thing is sleeping and breathing. You got to be able to have one of these watches so you can find out exactly what's going on with your sleep. It gives you a lot of key information about your vitals and different metrics that can really protect your health. The more you know about your health, then you can make necessary modifications, and the more information you have, then the better you can communicate with your doctor. Now, this is one item that you can have. Another item which I think that is going to be beneficial, right? This is a ring pulse oximeter. Okay, very, very comfortable. I like to wear this sometimes at night. I don't like to wear the watch at night because I don't know, I can't sleep with a watch. Usually I come home and I take off the watch, and but since some people can sleep with a watch, I'm telling you about the watch because it's up to you to decide, what you want to do. I'm just going to share with you the digital components that you can use in order to be able to find out about key metrics about what's going on with your health. Now, the ring device, it's key because it gives you your heart rate instantly, and it also gives you your oxygen levels instantly, right? But it also gives you sleep information. It lets you know if your oxygen levels are dropping, because one of the things that you need to know that I didn't probably share during the video, right, is that when you sleep, right, you want to know if your oxygen levels are dropping, and if you want to know if your heart rate's increasing, because if it is, it's not good. Your blood pressure could be increasing while you sleep, and then you could be developing anxiety while you sleep. You're supposed to be nice and calm. So anyway, I don't want to waste too much time with this because this video is going to be too long, but this pulse oximeter ring device. It's a lot better than one of these ring devices that you put in your finger, because sometimes when women, especially, they have nail polish, it interferes with an accurate reading. So you want to be able to get a ring device like this, because you sleep with it. It's like an abbreviated sleep study that you get every single night, but you're able to find out. And sometimes when I first got it, I used to have good night's sleep, but sometimes I didn't. And I'm like, what happened? Why did my oxygen levels drop all the way to like 90, all the way to 88, and all of a sudden, they come back up? But like, why? What did I do? So I definitely think that one of these things are key. I'm going to leave a link in the description so you can take a look at it. The most important thing, listen, I'm not trying to, with these products that I have, I'm not trying to make you buy anything. Some of these products I don't even have no affiliate whatsoever. I think I did before, but I don't have it anymore, because I don't make a lot of videos on these products. I use them, but I'm just want to educate yourself about the different things that you can do. The more education you have, right, the more you know of how to deal with these conditions, then the better you'll be able to proceed, because you cannot leave it up to a doctor. The doctor's not going to tell you everything that I'm telling you. The doctor's going to examine you, give you medication, have a sleep study, and that's final. I'll put you on a CPAP and you're done. He's going to go on to the next patient. I've been speaking with you about 40 minutes. The doctor's not going to speak to you more than 10 minutes. He's not going to give you any solutions. Okay? This channel will give you solutions, and then obviously it gives you tools, and you can go out there and you could become more educated about the decisions that you need to make. So now, the ring device, it's key. I'm leaving a link in the description. Now, something else, right, that you can use is, this is really, really advanced. This thing, right, it's a smart ring. Smart rings are exploding in the digital healthcare space, right? So you open one of these things up, you take out the ring. It's like a wedding band, okay? You put it on. Well, I got my wedding band here, man. You put it on. Look, you see? And it gives you key metrics and vitals about your health. And it's connected to an app. And when you wake up in the morning, you get a full report about what's happening with your sleep. And the information that it gives you automatically, it is key. I'm not going to get into the information. I have videos on what this ring device does, but it is amazing. Smart rings are exploding. I mean, the pulse oximeter, it's a little bit more economical. You get one right away. You can put it right in your finger. Now, the smart ring, it's a little bit more expensive, but the only thing that it takes a little long for you to get one, because they'll send you one, but they also send you a sizing kit, and then you need to try it on, and then you call up the company. So all that can take up to a month before you get your smart ring. But if you want it, I definitely encourage you to do it. It just takes a little bit longer. You can get this within a week if you really want to find out, if you want to have like an abbreviated sleep study. Now, if you also want to get a sleep study, right, you have the sleep screener here, the AP20. This is a device that it has a band just like a watch, and then you hook up a device that goes into your nose, and it can give you an abbreviated sleep study, and you can find out key information about what's going on in your sleep. Obviously, this is a little bit more. You can't use this every night to go to sleep. Well, I mean, you could. It's definitely much more comfortable than those home sleep study. But this is like a home sleep study. If you decide to get a home sleep study and then you get one of these devices, you're going to be like, this is almost the same, except the home sleep study, you strap it to your chest. This home sleep study, you strap it to your wrist, and then from your wrist to your nose, but it gives you vital information about what's going on with your sleep. Now, when it comes to blood pressure devices, right, I don't like those old-fashioned blood pressure devices that you need batteries. This blood pressure device, right, it's called Check Me, right? You put it, it's a cuff that goes right into your bicep. And upon one charge, it can last up to 500 reads. And it doesn't have any cords, doesn't have any strings. And it's very, very digital. Especially those that suffer from taking their blood pressure, right? You put it on, you don't have to take your blood pressure right away. But when you feel nice and calm, you press a button and it gives you blood pressure automatically. It's an advanced digital blood pressure device that can give you key metrics as far as your blood pressure, especially if you have conditions like high blood pressure, anxiety, the diabetes, these things. But anyway, guys, I think that I gave you pretty much everything that I could. When I said this is the ultimate guide, you know, I'm sure there's going to be other things that we can use for sleep apnea, but I think I gave you pretty much all. And oh, I almost forgot. Exercises when you have sleep apnea are really key. I'm going to put a link in the description of exercises that you can do for your face. They can strengthen your jaw muscles here, and very, very simple exercises. You do about 20 right before you go to sleep, and it can push your jawline, your bottom jaw forward, and it also helps the shape of your face. So the exercises are key. And also regular exercises, stretching. Stretching is one of the best things that you can do for your health. Okay, you do not want to get hurt, especially if you have any radical moves. You want to be able to stretch, and one of the best stretches that you can do, you want to be able to stretch so you can have good posture. So you can look up on YouTube, perfect posture stretching exercises. It's good for your shoulders. It's good for your neck. It's good for your core. It's good for your legs. It's good for your entire body, because when you get older, do you want to get older and have bad posture, you know? Or do you want to be elegant like a model? You want your shoulders back, nice, slim neck, good posture. You want to be able to walk straight. Remember, it's not just about looking good or having a good physical appearance, although there's nothing wrong with that. You decide you want to look good, you want to look bad. But it's also good for your health to have good posture. But anyway, guys, I don't think that I want to keep you guys here too long. Again, this is Louis from ndxaction.com. And with that in mind, I'll see you in the next video. Bye-bye.